most famous physical therapist on the internet.
Well, hi there, folks. I'm Bob Shaw, physical therapist.
Brad Heineck, physical therapist.
We are the most famous physical therapists on the internet.
In our opinion, of course,
Humble
Bob.
opinion. Today we're going to talk about how a pelvic tilt can stop your back pain, and we're going to show you how to do it.
I'm convinced that the majority of people, if they could get their body awareness of their pelvis, can really change their back pain, or if they're going to get back pain.
Right. It's basically posture for the back, and
exactly.
you got to get this right. We'll show you how to do it. If you're new to our channel, please take a second to subscribe to us. We provide videos how to stay healthy, fit, pain-free, and we upload every day. Also, join us on our social media channels and our website, bobandbrad.com, because we're always giving something away. Right now, we're giving away the Pro-Point. These are like myofascial release. What would you call them?
Massager.
Massager.
Yeah, it's for trigger points on your back. It works well on the bottom of your feet. You can put it on the floor, work your back, lay on it, your
It'll
feet.
also stick to walls if the wall is very smooth.
There you go.
Or
it's got a suction cup.
Yeah, I think a refrigerator maybe work.
Well, yeah, you can do that before you get your ice
food.
cream.
Oh, there you go. It's also, the giveaway will be pinned to the top of the page on Bob and Brad at Facebook. If you want a short version of us, go to Twitter, Instagram, or TikTok. 60 seconds of Bob and Brad a day.
There you go.
All right, so we're going to look. Oh, it fell down, Brad.
Oh, my goodness.
We're going to start by looking at the pelvis here, so what we're trying to actually do. So this is oriented. Do you mind getting oriented just like this is, Brad?
Well, you have to turn that around.
Oh, you want to be that way. Yeah.
Well, I got the red tape for a visual effect.
So if you are in what we call a posterior tilt, the pelvis here is actually going to posteriorly rotate or rotate back. And what that does, in effect, it rounds out the low back.
Right.
And that puts stress on the ligaments that'll hold bone to bone. They can actually stretch out and become unstable or unstable.
The discs as well.
And the disc as well. We're going to show you how that can affect the discs just by having this rotated back. So what we want to do is actually rotate it forward a bit and get a little more into the anterior or neutral position.
So I'm posterior all the way on. Is that showing
posterior.
up, Lonnie? That tape, and then if I go all the way to the anterior, we want to go about halfway in between and get in that neutral position. Still a little arch in the back, but still, we're using our core muscles.
And to be honest, when you're sitting or when you're lifting, it's hard to go into too much of an anterior tilt, to be honest with you.
Right.
You want to tilt it as much as you can, and you're going to be lucky if you hit neutral then.
Right. And then you're going to use those core muscles to help support. And
yeah, we'll show you more of that as we get into the sitting.
Sure.
Just want to show it with the scale here with the
models.
Yeah.
So this represents your lumbar vertebra, L5, right there, the lowest one. And then the green ball represents the disc, which the disc has.
And this would be L4.
Yep. There's fluid in the disc, nucleus pulposa, and the disc is flexible. So if you do posterior pelvic tilt, we first talked about, it can put pressure on. And then particularly if you do that and do some bending or lifting, that can lead into this. You got that?
Over time.
Especially.
You know, if you do it repeatedly day after day, go into the posterior pelvic tilt, you can eventually wear out the back of the disc, and it can cause problems like that, causing a bulging or herniated disc.
Right.
So you really want to keep your back in what we call the locked-in position, where you're nice and straight. It's designed to be the strongest when it's in this direction.
When he says, well, we're kind of contradicting because there should be a little arch in there. But if you think straight, for the layperson, it usually works out well.
It's a little confusing because, you're trying to get a little bit of an arch in the low back, and that I consider that to be straight.
Right. Yeah, there we go.
So we're going to start off showing you how to do a pelvic tilt. We're going to do it on the mat here. I'm going to grab a pillow. You mind moving your sign there, Bradley?
Oh, yeah. Oh, yes. We'll get the sign out of there.
So the best way to start this is to train on the bed first, because most people really have a lot of difficulty knowing how to do this, Brad. They have poor body awareness, of where their pelvis is at. Can you
Right.
see okay?
Yeah, we've got the red tape on our belt line so that it's easier to see the movement of the pelvis.
Now, I found usually it helps to bend the knees. You
Mhm.
found the same to be
Yep,
true, Brad?
I agree.
And a lot of times we'll tell you to even as a feedback mechanism, put your hand in your low back.
Right,
And what you're trying to do is tilt the pelvis, which in effect causes you to squeeze against the hand.
right.
The back should be flattening up against the hand.
Yeah. So you're putting your hand above the belt line, and that we call it the lumbar area.
Now that's a posterior pelvic tilt. That's the tilt we don't want you doing, actually.
Right.
But I'm trying to just teach you to get a feeling for what the pelvis is doing. So here I'm going posterior or back.
Yep.
Now I'm going anterior. And this is the one you're going to want to learn how to do is the anterior. And this, you're taking stress off the hand and you're moving the pelvis. You're tilting it this way.
Right.
So do this, do this 10 to 20 times. So you're learning body awareness. You're learning where your pelvis is at in space.
So here Bob is, his skeleton is doing this and then doing this. And, it's amazing what movement you have in the pelvis and the low back that you are not aware of. So this helps teach that.
Right. So the next thing, you might want to try to progress to a seated posture. I'm going to just do this right off the edge here. Do you
Sure.
mind move it down a little bit, Brad?
I don't mind.
So this would be the next area where you're now trying to learn.
Here, we got to
And-
get your shirt up so they
Yeah,
can see.
and again, if you
see
slouch, that almost naturally puts you in kind of the posterior tilt, or the
Right.
bad tilt. And so we want you to straighten up and also
No, look
tilt
at
your pelvis a
you
bit.
See that extra motion that really changes your posture overall.
Now I'm really not anteriorly rotated or rotated forward too much here because when you're sitting, it's hard to get too much.
It is.
Yeah,
It's just the
so-
mechanics of the hips.
Yeah, so you can almost go as far as it'll allow you, and then you can. Sometimes we have you actually put support in
pull.
your. Yeah.
There you can see that. There you
Sometimes
go.
we
Go back
actually-
and forth, Bob.
All right, hold on just a second.
Get some
Okay, ready?
hip pelvic motion. There we go. So we want it there and kind of there and hold it in.
Yep. And sometimes you can actually use a back support to help hold you in position, like when you're in the chair.
Yep. That's
And-
what we talk about. Just start out with just using the towel roll and put it there, and that's going to help maintain that pelvic position.
And that's why it's so important to use something like that in your vehicle, especially when you drive a lot
Yep.
or when you're at your desk all day.
Sure.
Now, if you are a person with larger curves, you're going to probably need a larger towel,
Right.
a little more. If you're a slight person, which I consider myself, I need just a thin little
Right.
piece of foam is what I use.
And it depends on the cushion of your chair or your vehicle seat, if it's softer, or it might be wore out. If it's wore out, even if you're a thinner person, you might need a thicker one.
And some people have the built-in lumbar support.
Ah,
They have
yes.
they have the little spin the wheel, right?
I advanced now. I got a button. Little.
Oh, you
push
do?
a button. It goes. Bzz, bzz. It's fun.
It makes that noise, huh?
Well, in my head it does. It's electric.
And after a while, you try a towel first to figure out kind of what thickness you like. Then after a while, you can go out online and you can purchase. McKenzie makes.
They make a nice cushion, and they have different sizes and different intensities. I mean,
Right.
densities.
Densities,
Yeah.
right. So, all right, now you've learned to do it in the seated position, maybe with the help of a support to get there. Now you're also going to want to learn it to do it standing, because when you're standing, you really want to learn how to do it when you're lifting. So I'm going to tilt my pelvis anterior a little bit, and now I can reach down. And again, as I get down here, it's really hard to keep the back anteriorly rotated. So I rotate as far as it'll let me go.
Right.
Because it will really put me probably just in neutral is what happens at that point.
But maintaining that nice straight back to and hip hinging, and there's a lot of mechanics with lifting going on
Yeah.
here.
So I'm trying to keep this arched, keep the pelvic tilt while I'm lifting, and all the movement is coming from my hips. I'm keeping this like it's in a cast, and there's really no movement there. It's just staying in an arched position. That back is in a real safe position when you're doing this.
Right.
I mean,
Yep.
you can lift this way, you can shovel this way, you can carry things this way, and there's not that much stress on your back.
Yeah,
in
much
that
much
regard.
better for the back. So are we going to do the next
Yeah.
one?
Now the final thing here is that I've been finding this out lately, Brad. It's just a great. Brad and I invented the hanging handles.
Right.
Yeah. So what it comes with is you got 2 wall anchors. Basically, we have more here for other uses. The wall anchors are nice because you can also attach bands to them and do
Right.
exercises.
It's multi-purpose.
But these actually come off too. Right? I don't know if
Oh yeah.
you know, they come off, and you can just have this up there, and then you can go up every so often and just flip it on there. And what's nice about it, you can have it in your office even.
Sure.
But what the big thing about it's good for your shoulders and your posture, but it's really good for doing decompression on your back.
Yep.
And what I like to do is actually hang and actually do some pelvic tilts when I'm in this position.
Yep. So I'm getting shoulder, back, and now when I hang, and I think you do the same thing, I do a posterior pelvic tilt.
Yeah.
And it really is comfortable, feels good.
Yeah, it's just getting some movement in that back
Yeah.
while it's being stretched.
Right. And it's a little easier, I think, for most people. I know it is for me, while you're hanging, to actually feel your pelvic motion. So it's a good way for feedback. You can feel your back. I can feel my back touch the wall now with a posterior, and I can feel the arch. It's just easier, I think, than actually laying down. Plus, again, the shoulder. I got a pair of these for one of my patients. He's a carpenter, and he's going to mount them in his work trailer to go to work site to work site.
Oh, no kidding.
Because he's starting to get posture forward.
Sure.
So it's just another, and they're just incredible.
Well, I use them just religiously when I do work in the office.
Right.
Because I'll like every 20 to 30 minutes, I get up and I hang.
Yep.
And my back almost always cavitates or cracks pops a little bit because I've been sitting, even though I'm trying to sit in good posture, it doesn't always happen.
Well, you get involved with your work,
Yep.
and it's a
Oh, yeah,
lifelong effort.
Yeah, believe me, my wife came by and irritated me again recently.
Again?
Yeah, she said,
Oh,
she
Bob.
came over, I'm sitting, sit down, Brad.
yeah,
She
yeah.
goes, you know, you need to be sitting up like this. Like if a therapist wants to be told he has bad posture.
Yeah, well,
And I just told her, I'm really into something right now. I can't talk about
You've
it.
got a good wife there, Bob.
Yeah.
She cares about you.
All right, remember, Brad and I can fix just about anything.
Except for
A broken heart, but we can
this could this
your
is
pelvis.
part
We
of
can
the
fix your pelvis.
right, which it's all part. It all works
No, it's
together.
not. It's just we can fix your pelvis.
I know, but well, I was being optimistic.
All right, thanks for watching.